Have you ever brushed your teeth, used mouthwash, and still thought, why does my breath still smell? You're not alone. Especially after the age of 60, there are changes in the body that affect our breath, and brushing alone might not be enough. Today we'll go over 5 common but surprising reasons for bad breath in seniors, and more importantly, how to fix them easily at home. Let's get started. First, dry mouth. As we age, our body produces less saliva, and saliva isn't just for moisture. It helps clean away bacteria in the mouth. On top of that, many seniors take medications like blood pressure pills, antidepressants, or allergy meds, and those can make your mouth even drier. So what can you do? Try sipping water often throughout the day. Chew sugar-free gum to stimulate saliva, and consider using a moisturizing mouth spray or gel. Next, gum disease. You might not feel any pain, but your gums might still be in trouble. Gum disease often develops quietly, with little or no symptoms at first. Bleeding gums, loose teeth, and lingering bad breath. These are all signs. Be sure to floss or use an interdental brush every day. Visit your dentist regularly, even if you wear dentures, and ask if you might need a deep cleaning. Third, the tongue. Most of the bacteria in your mouth live on your tongue. That white or yellow coating. It traps food particles and produces sulfur, which smells like rotten eggs. Here's what helps. Gently clean your tongue once a day, using a tongue scraper or a soft toothbrush, and rinse with a gentle mouthwash if needed. Now, number 4. Sometimes the smell doesn't come from your mouth at all. It comes from your stomach. Acid reflux, indigestion, or H. pylori infection can all cause bad breath. If you often feel bloated, burp a lot, or taste acid in your mouth, your breath may be affected too. Avoid lying down right after meals. Skip late-night snacks and spicy foods. And talk to your doctor if symptoms don't go away. Finally, tonsils and sinuses. Ever coughed and noticed a strange smell, but couldn't tell where it came from? Tonsil stones, those small white lumps, can smell terrible. So can mucus from your sinuses dripping into your throat. Try gargling with warm salt water. Use a saline nasal rinse, and visit an ENT specialist if needed. So if your breath still smells even after brushing, don't worry, you're not doing anything wrong. You just need to look a little deeper. Small daily habits, like drinking more water, cleaning your tongue, and taking care of your gums, can make a big difference. Start small, and you'll see big changes. Thanks for watching. Don't forget to like, subscribe, and join us again at the 100 Year Life Club. Take care and stay fresh.